May I ask Dr. Ashok Sham to please come up and co-chair this session?
Okay.
Professor Rami Abood is from Dundee University and is the head of Department of Orthopedics at the Nine Wells Hospital and is running the MCH course. Professor Rami Abood.
No. Close it. This one, Rami Abood. Yeah, okay. Well, good afternoon, ladies and gentlemen. It's a pleasure to be here with you in Agra to talk about something that I haven't talked about before, understanding medical journals, indexing, and impact factor. I have so many hats in my role at the University of Dundee, but today I'm talking about something related to my new role that I took over a year ago as the editor-in-chief of the Foot Journal. What does it mean to actually browse through our intensive literature in medical journal? Dr. Parag earlier on talked about the numbers of journals available in the literature and encouraging you profusely to actually publish, undertake research, do your best to enlighten others about what can be improved in the medical sector. So is the question, do you really want to browse and understand medical journals, or in fact understand the question about research and what you're researching for and why? Do we really want to flood the market with papers and just papers, or do we want to make a difference in the medical arena? I would think the latter is the more appropriate one. I was recently at the editors conference organized by Elsevier in Prague, and Andrew Plum was one of their managers, actually came out with these three quotations, and if you can read them quickly, you will realize that we are actually flooded with a lot of papers. In any discipline you're studying, if you want to go through every single article published, it will take you a decade, you will die, and you will never finish finding what you were looking for. If you take the second quote saying that this is truly the decade of the journal, and we should seek to limit their numbers rather than to increase them, since there are too many of them. When do you think these quotes were said? Any idea? You want to take a guess? Because I was surprised myself when I discovered that these quotes go back as far as the 1600. Have we learned anything since then? Absolutely not. The actual rate of publication has tremendously increased. We're talking over 40 million publications. 20 million in the last 20 years alone. And with the general population increasing, no wonder we're going to have many more papers. So do we really need to publish, or we need to publish something that is going to make a difference? Who is to be blamed? The publishers or the journals? We have so many of them. Of course they are interested in that. It's good business. And it is you and I who are feeding into it as scholars and as academics. We want to improve our careers. We want to progress forward. And the way to do it is through publication and research. Most editors and most reviewers of all journals do it part of their scholarships and academic careers. They don't get paid for it. The person or the individuals that are making the money are the publishers. There are too many journals on the market, in my opinion. If you take Elsevier alone, the publisher of my journal, they have over 2,000 journals, over 20,000 books.
You have the next paper.
They publish at least a quarter of the papers on the market. So just imagine how many articles are being published yearly across the various publishers. So it's not the actual understanding of medical journals. I think you need to understand research and the research question, as Dr. Parag alluded to earlier on. Indexing, in my opinion, is a bit more important. It is important because it is the medium that others will be able to find your published research. And if you don't have your journal indexed, then you are in a bit of trouble. But every journal, when it's launched, is not indexed. And it's important to actually attract a good caliber of reviewers and editorial board members in order to have a solid content to get the journal indexed. Once that index, then you are on the right track. And the buzzword that you always hear is impact factor. But in the medical arena, in order to get towards that, you need to aspire to have your journal indexed in PubMed or Medline. So when you get to impact factors and you go through the web, you get all these lists according to the various disciplines. In orthopedics, there are many. I'm listing the top 24. And you can see that they vary from 4.4 all the way down to 1.8. And if you go through the list, you go to 0.2 or something. What does that mean? Does that mean that journal 1 is better than journal 2? That's what the impact factor would like us to believe. But how does it really work? Now, if you compare across disciplines and you go for the Lancet, for example, you're talking about 40 as an impact factor. It differs from one discipline to another. It doesn't mean that in cancer, the journals are better than in orthopedics. It's a different discipline, and we should not mix up these things. So let's look at the equation that they use in impact factor. It's simply based on the average of citations on the papers that were published in the 2 preceding years. And according to that number, then the impact factor is calculated. If we take, for an example, in 2008, if the impact factor is 3, it means that there were 3 citations per average per article published. So one article could be 6, one could be 0. The average is 3. That doesn't mean that all the papers in that particular journal are top-notch scientific journals. So basically, if you devise the equation of A, the number of citation, over B, the citable table, then you have an equation of A over B will give you the impact factor. So there is a game to play there. If you increase A, then your impact factor will increase. If you reduce B, the same thing will happen. And if you increase A and reduce B at the same time, you are really winning the game. But that does not really measure the quality of the articles published in the journal. So what would you do then? Taking your president's theme, unite to learn, learn to unite, definitely you can say learn to publish, publish to learn. And I think it's a very important message to take away. When I was approached in 1998 to join the Foot Journal by the editor as part of the International Advisory Board, the message was clear. We need to provide a multidisciplinary platform that never existed. And if you look at the actual listed articles in the impact factor list, there are only 2 foot and ankle journals that are not really leading with a multidisciplinary team. And the task that was assigned to me is that we need to make this journal indexed, and we need to try to get an impact factor. And then this is where you go from research to learn, learn to research. So in effect, if we learn how to research, we can build up and unite a team of researchers, and the reverse is absolutely correct. If we are a team united, we can learn how to research. So an important message when you're choosing the journal you want to publish for, it's not only impact factor, it's not index. Go and find out who are the editors, who are the editorial board members, and the reviewers. Because what you want to publish in a journal that's going to really uphold science above impact factor. In our journal, and over the last 10 years, working with the various editors before I took over the role, we have assembled such a distinguished list of members on the advisory board and the editorial board in order to achieve our tasks in index medicine, but preserving that foot needs a science base to improve surgery. So a brief history about the actual course has led us, after losing the British Orthopedic Foot and Ankle Surgery Society in 1997, to bring them back on board and have them affiliated with the journal as soon as I took over last year. And that's an important task that we have managed to achieve in order to push ahead with the impact factor for the journal. So what would you do next? Having both us on board, as well as the American College of Foot and Ankle Orthopedics and Medicine, it's the right opportunity and time to go for the impact factor. And that's what we've done. We have applied for the preliminary count, and the actual outcome came much better than I expected. But is this the message that I really want to pass on to you? No. What I want to pass on to you is that don't only think impact factor. Think, is that the journal that will suit best my research, my publication? This is where the most readers are going to benefit from it. And if it does, look at the 3 key words. Understanding medical journal, it's very important to be able to critique the papers irrespective which journal and which author they belong to. Impact, I would say it's a game. Go and read the declaration of DORA that was published in May 23, which I fully support. Indexing is very important in order to find articles. Thank you very much for listening. Thank you.
Thank you, Dr. Rami Aboud. Now may I request Dr. Ashok Shyam to speak on how to write a good scientific paper.
Good afternoon, everyone. So I'll be speaking today on how to write a good scientific paper. Research is nothing but pursuit of knowledge. We are all in pursuit of knowledge in each and everything that we do. We do research when we read our books, when we read our journals, when we see our patients, when we operate, when we rehabilitate. We do research all the time. This research accumulates over a period of time and constitutes our experience. That's what is labeled as level 5 evidence. What we need to do is formalize this process. How to formalize it, convert it into paper, and publication is what I will cover. Writing a paper is very frustrating. Somebody who has written an article and published, he'll understand what I am hinting at. It's a long process. Before you begin, you ask yourself, what do I have to say? Is it worth saying? How will this appeal to the reader? How will this appeal to the editor? Now, this is not at the beginning of research project. This is after you have completed your experiment, you have your data. Now you have your data analyzed. Now you're set to write the proper paper. So I'll deal with that part of it. Conventionally, the basic structure of a paper is in IMRAD format. That is introduction, methods, results, and discussion. Some may say it as SIMRAD, which S stands for summary or abstract. So introduction deals with why I did it, methods, how I did it, results, what did I find, and discussion, what might it mean. So this is the layout of the paper. Before going to the SIMRAD format, I'll just have one slide on how to format the title of it. Dr. Parag spoke about the PICO format, the population intervention control and outcome. The title should also follow the same format. It should contain all these 4 keywords along with the study design. So for example, a good title will be Prospective Randomized Trial Comparing Functional Outcome Between High Flexion and Conventional Knee Processes. It includes all keywords and it also includes study design, a very appropriate title. Let's go to the IMRAD format. Let's see what abstract means. Abstract is complete but concise description of your paper. It's the first thing that a reader or the editor or the editorial board will read. It should draw attention. It is your first chance to sell your paper in quotations. These are the various formats in which abstracts are given. Just read the bold things: background, questions, patient and method, results, conclusion, and clinical relevance. Backgrounds, not more than 2 sentences, rationale behind doing the study. That is what the focus should be. Question and purposes, few journals like CORA do ask for it separately. If it is not asked, it becomes a part of your background or introduction. You should clearly mention what is the aim of the study and if needed, the hypothesis and also what questions the study is going to answer. Patient and methods, the major techniques and what the outcomes are measured. Just 2 or 3 lines, not more. Results, only major and significant results have to be briefed in. Last, the conclusion, and most importantly, the clinical relevance of your study should be mentioned in the end. You should avoid abstract being too long, too short, too detailed, or too superficial. Unexplained references, or unexplained short forms or references. References have to be completely avoided in abstracts. Abstracts to make sense in itself should conform to journal guidelines. This is a very important point. So mostly they are of two types of abstract, structured or unstructured. Structures follow the IMRAD format, and typically North American journals follow this format. Unstructured is like one single paragraph. Mostly the European journals follow this format. The word count will also be mentioned in the guidelines. Let's move on to introduction. Introduction is where your story begins. It is told in three parts. It begins from what is known, from what is unknown, and ends with what your study will try to answer. So it's like a funnel shape. It's like doing a literature review. If you review the literature, from far away it will look very seamless. Your textbooks look like everything is known. If you look at it closely, you find gaps in literature. What introduction or literature review does is look at one particular gap or one particular question and detail it for your readers and for your editors, and tell them that you are going to answer this particular question. So what is known? You have to give background statements, 2 or 3 sentences, don't overwhelm them. Give specific to your particular question, not the entire topic. So if you are doing a research on CTV and Pirani score, talk about the scoring, not about the pathogenesis or etiology of CTV. Move your story forward fast. Move towards what is unknown. Describe what gaps your paper will fill. Mention other abstracts and preliminary studies. Focus on last 5 years papers or last 1 year papers if the literature is too big on the particular subject. Avoid using names of the investigators. Keep references to minimum in the introduction. This is the last part of the introduction, the last paragraph. It is around 4 or 5 lines where you state your particular hypothesis, where you state what you are going to study. It should proceed with a phrase such as, in this study, we are going to do this particular experiment to answer this question. So it should be very specifically mentioned. As editors, we look for the question just above the material methods part. So that paragraph should specifically mention this. It should awaken interest. You should think about what the reader will be thinking. Will this question be clinically relevant to him? Material and methods, it talks about study design. It should be based on the aim of your study. It should have inclusion criteria, exclusion criteria, outcome measures. You have to specifically study them. They have to be valid and they have to be applicable to your particular study. Tools for methods and data collection, you have to specifically mention the surgical techniques in detail and end point of your study. The study has to be described in detail so that other researchers who are reading the article should be able to perform this study independently. The last paragraph of material methods is the statistical part. You need to mention 2 or 3 lines on what you are going to compare and which test you are going to use. We come to results. Results are actual study findings. They should be clear and concise, should convey important points only, and should be unbiased without interpretation. Don't start interpreting in the result section itself. Mostly avoid writing complete numerical data in your text. Refer them to tables and figures. Highlight only important findings or significant findings. Describe results that cannot be shown in tables in the text. You should begin with demography, start with follow-up. If there are any protocol violations, it should be mentioned in the beginning itself. The primary outcome, the secondary outcome, and the subgroup. This is the order that we follow while putting our results in the article. For writing the data part, you should always write mean plus or minus standard deviation in bracket range. Every numerical data has to be put in this particular format. Percentages have to be put in the like 60% has to be put in 6 divided by 10. Out of 10, the 6 subjects are positive for the particular finding. Common pitfalls are describing methods. Don't start describing method in your result section. Don't present partial or selective results. Present all your results in the result section. Don't improper presentation of p-value is a very common problem. Put exact p-values, not only less than 0.05 or less than 0.01. Put exact p-value till last 3 decimals. Don't duplicate results from tables and figures. Do not repeat them. Make your results very short and sweet. Discussion part, what does it aim at? It answers the question that is raised in the introduction. It explains the results of the study. It discusses your research in context with the related literature and brings all your results in perspective with what is the current scenario going on. So it has a huge task. So it brings to context and also expands the perspective. You also need to mention the strength and limitations of your study in this part. It has 4 parts: discussion, introductory paragraph, the body, strength and limitation, and conclusion. Introductory part is a small, short context. I say it has 3 sentences only. The first is the crux of introduction, your research question. Second part is your material methods, that means how you did it. And third is what the results. So this is the first paragraph of your introduction. The body of the introduction is quite elaborate. It helps whatever results you get. You discuss only your results in your discussion, not the pathology or any other part of the study that you are doing. Only the results part, whatever you have got, significant or not significant. You compare with the existing literature, show the reader and the editor how this thing adds value to the current literature, and discuss reasons for differences. Strength and limitations have to be mentioned, specifically the bias has to be mentioned in the study. The conclusion should focus on whether the hypothesis was proved, whether the answer was achieved, what is the future scope of this study, and how does the evidence support it. The 7 deadliest things that you should avoid: data manipulation, falsification, duplication of the manuscript. Don't submit it to 2 or 3 journals at the same time. Redundant publication, don't publish old data again. Plagiarism, conflict of interest, and human concerns. There are 3 golden rules for articles. Words are at premium. They are limited by journal guidelines and also by reader's attention span. So use them very carefully. Every word has to have meaning and should not be used unnecessarily. Second is, think about the readers and the editors, their perspective. Also, always put yourself in shoes of the reader who is reading your article. They might have a very different perspective than what you are having. And last but not the least, give time to your paper. Don't hurry it up. You are creating something that is timeless. Anything that is timeless will require a lot of time and a lot of effort. Thank you.
Thank you, Dr. Ashok Shyam. Now, may I call upon Dr. Indrajit Sardar from Kolkata. He will be presenting his paper, How to Present Paper in Conferences, PowerPoint Tips. Very important for conferences.
Now that you have done your research and you've written a paper and you want to present it at a conference, you're left with this to think about how to make a good PowerPoint presentation. And before you start, you've done all that hard work and reached something. So once you start to decide the PowerPoint presentation, you have to make it effective enough for your audience to look at it. So what is a PowerPoint presentation? And a PowerPoint presentation means slides, your PowerPoint slides, and the presentation itself. And the presentation itself of what? Obviously the topic, and but more importantly than that, it's a presentation of yourself. So if you make a sloppy presentation, if you make an unclear presentation, you're projecting yourself as an unclear and a sloppy person. Preparation, of course, is there, and you have to do a little bit of research on this. What is the audience that you're talking to? What is the topic? Generalize or specific? When are you doing it? In the morning, afternoon, or evening? And this counts because the morning audience is more alert, while the evening audience is just about trying to get home. The length would be 6 minutes, would be about 15 slides, 8 minutes, 20 slides, and there are fast speakers who can do more than that. Where are you presenting it? Is it in an auditorium? Or is it in a pandal where the light quality is not that good? Or is it in a small room? And then finally, before or after whom are you presenting? And if you've got an excellent speaker in front of you, then you have to be careful that your presentation must match that. What is the audience? Are they your peers? In which case, you don't have to go into the basic stuff at all. You only talk about the details part of it. Is it educative enough for the postgraduate trainees, perhaps? In those cases, you have to go a little bit more basic. And if it's for lay persons, then of course your PowerPoint presentation must include very, very basic points. Audience, you describe the essentials colorfully and choose your weapons, because you have weapons in your hand. One is the text that you're using, the message, the images that you're using to illustrate the project, and animations, but use them wisely. There's nothing more important than getting an audience like this. The audience is supreme. I mean, if you lose the attention of your audience, again, an audience like this, then everything will be lost, all your hard work. And it wouldn't matter how ingeniously you have done your presentation and how well you have presented the case, constructed your slides, your presentation has gone for a 6. So the topic now, is it a focus topic? If it's a focus topic, you have to be very clear about what you're talking about. You have to be precise, you have to be accurate, and you have to do a minimum of words. But if it's a generalized topic, you have to bring in a lot of other factors to get the interest of the audience. You have to compose your slides like a music composer. You have to leave room for highlights, you have to leave room for messages, images, and that will make a proper slide by itself. Look at this slide. This slide is a chosen system, should have a number of levels, etc., etc. But really, can you read this slide? Look at the color combination below. It's absolutely dark. And this is a situation where you think it's a bad slide. Look at the fonts. You use very readable fonts, not this. You maintain the same font, and the size is 32 for the body, not this, and 44 for the header. Certainly not what is on the side over there. You compose your slides and you decorate them, but you decorate scarcely but well. Don't make your decorations the first part and therefore overwhelm the slide. Restrict the room your design takes up, and don't ever let the design restrict your message. You have a number of very attractive PowerPoint backgrounds, and if you use that, your message, what you're trying to say, might get lost. Look at this slide. This is a PowerPoint background that is there. And this is taken from one of the PowerPoint slides. And this has too many interfering lines, too little space for your images and messages. Very distracting. I constructed this just from the PowerPoint equipment, what is there. And you can see this is a very simple thing and leaves a lot of space there for a simple design, lots of space for images and text. And after all, it's the images and text that you're going to convey to your audience. Do not overload. And I'll keep on repeating this time and again. Do not overload the slide. You may use your hospital logo. You can highlight your headers. You may create a special frame for your figures, images of the whole slide. But do not put too much information on one slide. It's not a busy slide. It's a heavily loaded slide. And this will really detract from whatever presentation you're giving. And this is what I call by an overload slide. You can see so many pictures. You don't know which one the audience is going to concentrate on. And they're really confused. But if you had done only one or two and then pointed out the relevant things, that would have helped a lot. Look at this slide. It's a total knee replacement, infected total knee replacement, and what are you going to do about it? Which procedure will give you the best results? And look at this. Do you think any audience is going to look right through everything and look at it and get your message? But the same slide, look at this. Retained implants, retained implant, debridement, and antibiotic suppression. This gives you a 27% rate. Retained implants, antibiotic suppression only, 29%. Implant removed, one stage, 77%. Implant removed, two stage, 86%. And that's what you really wanted to convey, that a two-stage implant, a two-stage procedure is the best way of tackling this infected total knee replacement. Follow the rule of 6. Use 6 words to a line, use no more than 6 bullets, and use no more than 6 lines. And that keeps the slide nicely balanced, and your audience can read it properly. And this rule of 6 is a useful thing to follow whenever you're presenting your slides. Use contrast. Black text on a white background, obviously, is very, very good, but it's very boring. So when it colors, you use the wheel, and you look at this, the opposite aspect of this going on from one aspect to the other. Excuse me. The colors use wheel. Apply brilliance. Carefully use color to highlight your message. Don't weaken the color affected by using too many colors. and make a brilliant choice. You can match the colors. There are websites over here which you can really contrast and see your sites. And then keep this in mind. Well, this is Barack Obama's favorite picture. But KISS here means keep it simple, stupid. Use keywords only. You don't have to write an entire sentence over here. Don't put a big, long sentence and people will get bored. And do not read your slides. You should just add to them. Because if you remember that your slides are only there to support what you're saying, not to replace your talk. Your talk is important, your message is important, and the slides are only there to help you in getting that message across. Have more images than text. Images are more attractive to the audience, and use these images to complement and reinforce your message. But again, remember, do not overload, because that is a position you'll find yourself in. Images are a very key element, and they're visual clues. So you must adjust the brightness and contrast. You can do that in a photo editing software, or else you can do it from PowerPoint itself. And you must crop your pictures to highlight the areas of interest instead of pointing it out repeatedly by laser pointer. Look at this picture, very messy. It's just to show that there was a transtrochanteric femoral approach done to take out an implant and then the suture. But it's awful, it's disgusting. The same thing. And you can see on the close-up, now the audience can focus on exactly what you're trying to say. Animations, use animations judicially. Don't get, taken away by some attractive animations you've seen. Use simple ones like wipe or dissolve or box, and that is enough. Fancy animations will waste your time, and make sure your animations can work in back editions, or else these animations will swallow up your slide. Use videos. You edit the videos using Windows Movie Maker. Now, Windows Movie Maker is there. It's very simple to use. You just have to learn it. Make them MPEG files. Use the conversion software if you have videos in another format. Take your videos in correct orientation all the time. And you can see those vertical videos that are playing, and you have to crane your neck at right angles to see what is going on. And you save the videos in the same folder as your presentation. Thankfully, in PowerPoint 2010 and above, the videos automatically get saved to the PowerPoint. And practice. Know your slides inside out. You speak freely. You speak with confidence because you know what you're speaking about. And speak loud and clear, and maintain your distance from the mic. Don't go too soon and it goes like that. And don't get too away because it can't be heard. And don't speak too fast. And maintain an eye contact with your audience. That lends immediacy. That lends a contact. You're really getting across to your audience. So maintain your eye contact with the audience. Give a take-home message. It's your message, the summary of your data or your story. Make it a highlight that stands out. And laser pointers, this do not play around with it. There's some presenters who go like this all the time. It's very, very distracting. So keep it there, highlight what you're saying. Remember, it's very distracting. And finally, finish on time. That's my time. Divide the presentation into many parts. Keep track of the lap times. Nothing more irritating than overstepping. Look these up. And finally, break the rules occasionally. But remember, only if you know the rules. Thank you.
Thank you, Dr. Indrajit, for your nice presentation. Now, Dr. Ashok Shyam will present on the tools for research. If you don't understand the tools, how will you present your PowerPoint presentation or write a scientific paper? Dr. Ashok Shyam, please.
Hi, good afternoon again. Thanks, Dr. Indrajit, for a nice presentation. Now all my slides will be judged. Let's see. Okay, I'll talk for tools or research, apps, websites, and software. I'll focus mostly on mobile applications because that is the rage right now. So let's begin with, what is an app? It's a small program that can be downloaded to a device to carry out special function. So they don't make it inbuilt, you can download as per your requirement. Apps for journals, apps for images, apps for videos. I'll talk about these apps most of my lecture. I have divided them into clinical and educational apps, apps for patient education, and general apps. Let's begin with clinical and educational apps. There are journal apps, educational apps separate, societies have made their own The first journal to make an app was Acta Orthopedica. BJJ Abstract Manager came later. Bone feed, hand feed, bone cast, I'll talk about them specifically. JPOA, B, American Journal of Sports Medicine. So these are most of the journals that have mobile applications currently. The search is very limited in mobiles. Organization and arrangement of needs lot of improvement currently. This is the Bone and Joint Journal application. We get Bone and Joint Journal, Journal of Bone and Joint Research, and Bone and Joint 360. All three in the single app. If you have taken a subscription, the application gives you a full text PDF also. So this is how the interface for BJJ looks like. This is the entire current issue. If you click on it, individual articles can be downloaded PDF if you have a subscription. This is how Bone and Joint Research looks like. It's an open access journal, so you can download the PDF and read on your mobile itself. Acta Orthopedica is one of the most beautiful interface that I have seen. This is an open access journal, so all the issues are free. Once you click on all issues, it will show all issues, and PDF files of every article can be downloaded and read on your mobile phone itself. So Acta is the first journal, and it is the only journal that gives you full free access on mobiles. Bone feed and the remaining things that I'll talk about, these are taking RSS feeds from various journals. These are like syndicates taking from various journals. The table of content will get updated every time they are updated on the websites. So like this is JVGS American, it will give you can add all the journals that you want. It will give you abstracts of all the articles, and if there are any free articles available. You can share this on social media also. So whatever you're reading, or if you want to talk with your friend, you can post it there and maybe create a discussion out of it. Orthopedics Today is one of the best read newsletter regarding orthopedics. It has a lot of expert opinion and discussion fonts. These are now available on mobile, and you also get full text PDF articles. It also gives you discussions, recent news and videos if they are uploaded on the site. So these are all the journals that currently are available on mobile platform. You can see most of the orthopedic premier journals are not yet available, but they are working on it. Books, Campbell's Operative Orthopedics is available on mobile platform, but it's not the entire book. It constitutes mostly on the surgical techniques. So surgical techniques of various procedures have been described, almost all of them. It has been organized in the format of the textbook. We also have the detailed description of every procedure, figures and videos, which are very helpful at times of references. However, this is a costly application. It costs around $100 for downloading. But you get all the videos inbuilt in the download itself, so you don't have to need internet access every time you access this application. AOS eBooks is now launched recently. However, you have to buy the books on the website, and then you can sync it with your application, and you can read all the books on your web or iPad or tablet, anything. Educational apps, these are very useful application as far as treating patients regularly are concerned. I mostly like these four of them. AO Surgery Reference app, this is a very nice application. You just click on the bone that you want to see or the fracture that you want to study, and it gives you a diagnostic outline of it, a description of it, also how to decide the recent articles on that particular fracture or particular pathology, and how the decision has to be made. It also gives you indications, advantages, and overview of approach with a complete description of the operative procedure if you want to read one. Also focuses on rehab protocol of the fracture. Muller classification is very useful for, I think, residents and students. The entire classification is given here. You just roll the dice, and whatever classification you come up with, it will show a description of it, the entire classification, and how to diagnose it. AO Trauma Line is another good research resource, I will say. It compiles all the articles related to the particular area of interest. So if suppose you click on proximity universe or distal radius, you get all the articles that are there, plus it also shows the level of evidence. If you click on this, it will show you the level and the abstract that is available from the website. So it compiles, if you want to read about shoulder fractures, you can get all compiled evidence and one particular place with this mobile application. Very useful. I read this mostly when I am traveling from one place to another. It's a very useful update for you to have. You can also pin board. Suppose you like a particular article but you don't have the full text currently. You can just pin it to your board and it will remain till you have a web access where you can access the article. This is Orthotraumapedia. It was prepared by two orthopedic surgeons. It's like a mobile textbook. So it will give you an condensed introduction about whatever pathology fracture you are looking at. So suppose you are looking at acetabulum fracture, it will present you facts, it will present you how to diagnose it, it will present classification, treatment options. So it's like a textbook, a small mobile textbook that you can read and update yourself. You have Tumorpedia, you have Tumorpedia foot and ankle, all follow the same thing. They are just like small textbooks that are present in mobile. And these are not costly, these are like $1 or $2 each of them. General applications, CCJR, ICJR, Hippocrates and Medscape. These are the four ones that I recommend. CCJR is a current concepts on joint replacement surgery. Most useful part of it is all the lectures that has been happened in CCJR till now are updated as videos of surgeons speaking on them and the slides that are available. So it is a very useful app. You can download it while your phone is at home and you can anytime listen to those videos. It comes to your, it saves on your phone once you download it. So you don't have to download again. ICJR is International Congress of Joint Reconstruction. Almost the similar format, just the layout is different. Again, the presentation and the videos can be downloaded and watched later. It has very good videos of surgical techniques and tips and pearls by eminent surgeons all across. This is Hippocrates. I use it mostly to see if there is, if I am prescribing some medication to a patient, he is already on 5-6 medication. Will there be an interaction between them? So I can have the interaction check that is on the first row. So you can check whether the medicines that you are giving will interact with his diabetic medications or hypertensive or renal diseases or even pediatric things. So you can also calculate the doses and everything. For the medical part of orthopedics, this is a very useful application. It's called Hippocrates. Medscape again gives you a very it's an overview of particular disease. It gives a comprehensive overview of, if you want to read about, say, vertical talus, you can go to Medscape and read all about it. So it gives you a recent, these are updated almost like every 2 or 3 months. So it's very recent also. Utility apps, these are the 7 apps that I have enlisted to show today. Multiplier is useful for people who are treating pediatric cases, deformity corrections. Here you can check the limb length discrepancy, how much is the growth remaining. This is according to the PLS formula. So you put in the details and it will automatically give you limb length discrepancy at maturity, and there is a whole guide to explain what all it can do, and it's very useful for pediatric cases. Medical scores SF36 and OST disability score index have been available on mobiles. You can download them and score your patients or give to your patients and they can score themselves. This is a goniometer application that we have developed, the Indian Orthopedic Research Group has developed. You can download it and you can measure knee range of motion or range of motion of any joint in the body, and it can record all your measurements according to patient's name and details. Knee registry is another application developed by Indian Orthopedic Research Group. In this we have the goniometer, we can measure angles on the photograph, on the x-rays in the mobile itself. So it has an angle measuring device, it has a goniometer, it records all patients' details, and it gives you knee society score and knee function score automatically if you fill in all the details. Over that, it gives you statistics of the data that is accumulated in your phone. So it's a very useful app and been used by a lot of them. Patient education application is by Okra Health. This is what I've seen. There are a lot of them, and these are most useful to show your patients when they are in your clinic, and you can show them 3D models of spine and hip joint. Photography is very useful for, these are the 3 applications that I'll recommend. And another one, I mean, you can see this is one for X-ray that is sent to me on phone. I can change it using an application called Adobe Photoshop Express, and it looks much better now. I can see the fracture, I can see how the reduction is done. Website for research, the most important is PubMed. If you know how to use PubMed, you don't require any other website for research. Google is another one of them. Cochrane Library, of course, for level 1 studies. You put your keywords and you get all the level 1 studies at one place. This is up-to-date website which gives a summary of all the current evidence for any particular keyword that you tap in. Ortho Evidence is another website. It's quite useful. It reviews a lot of articles and gives us good commentary on every article. Software for research, these are the 6 software that I'll recommend. Excel sheet is most important for research. EpiInfo and GraphPad are statistical ones. OpenEMR is a medical record system that anybody can use. It's free to use. Osirix is only for Mac and utilized for X-ray and DICOM images. Social media has been used extensively since last 1 year. For even IOACON2013 has used it extensively. It's a good platform for discussion and generating a lot of viewpoints. Indian Orthopedic Research Group also has a Facebook group where we have 7,700 members. We actively discuss cases, discuss articles, journals, and everything. It gives a total different perspective of research, which is nothing but pursuit of knowledge. Thanks.
Thank you, Dr. Ashok Shyam.
Thanks.
Now, if there are any questions, the speakers would be prepared to answer. Can I request the speakers to come here, please? Dr. Indrajit Sardar, Dr. Ashok Shyam, Dr. Rami Aboud, and Dr. Parag Sancheti. Any questions? Well, if there are no questions, I would like one of the speakers to just dwell on plagiarism, how bad it is.
Plagiarism, I'm editor of 2 journals. I receive articles almost every day. 60% of the articles have plagiarism. I can say that. I've reviewed since last 5 years, 60% of articles have plagiarism. It's very easy to detect them. We have softwares. We put the entire Word file in the software. It automatically red marks all the areas of plagiarism. So what we do is, we send them back to the author immediately, saying that these are all plagiarized and we cannot accept your article. So most of the rejected articles are because of plagiarism. Suppose the editor overlooks it, it gets published. Suppose your article it's a hypothetical, but suppose it gets published and it is in print since 2 years, somebody reads it and picks it up, that is plagiarized, and he writes a letter to the editor saying that your article is plagiarized, that brings a very bad name to you and entire research career. So be aware of it. It's a very, very serious thing. Don't let your students or your trainees write the article and just submit it. You need to check it for plagiarism. Ask them specifically that whether they have plagiarized or not. Most of them tell you that they have copy pasted. Ask them to revise the article and then send. It's a very, very rampant currently.
Thank you very much for your patient hearing, and with this we come to the end of the session. Thank you very much.